honor to introduce our next speaker. He called the doctors who were in the room this morning legends, but I can say that Claas might be a bit of a legend as well. Claas is a full-time patient advocate. He's chair of NF Kinder in Austria. He runs the NF Center of Expertise in Vienna, and he organizes a lot of psychosocial support projects. He initiates and supports research and improve access and quality of care. And most of all, he was chair of NFPU before me. Claas.
Thank you so much, Karin. Yeah, so happy to be with you today. And I wanted to share some experience we made in Austria of how we were able to work together with healthcare professionals, because I hear sometimes other organizations are struggling doing that. And I hope that our experiences can be useful and for you, and maybe some best practices that you can use. So what was the initial situation in Austria like when we started our patient organization? It was quite sad. There was no specialized departments focusing on NF in Austria. There was no active patient organization before we started. It was really difficult for patients and caregivers to get access to information. There were no awareness activities about NF, no educational programs, no network, no psychosocial support, basically nothing, but also no budget for us as a patient organization. So we had to start from zero. It really felt like a desert where nothing is growing and you feel really isolated. And yeah, it's hard to imagine that something can develop here. But there was the neuro-oncological department of the Children's Hospital of the Medical University Clinic in Vienna, who were knowledgeable about NF. That was where I also landed when my daughter was diagnosed. So they provided the diagnosis, and we really understood that they were knowledgeable about NF. There's also a human geneticist, Professor Wimmer, who is the expert in Austria for genetic diagnosis of NF and other related diseases. And also there was a basic researcher who dedicated his life in studying neurofibromin. So it felt like there was a little plant in the middle of the desert, and if we can, as a patient organization, just provide some nutrition and some watering, maybe this can grow into a supportive network for patients and caregivers. So this was our starting point. And I would like to share with you some milestones that really helped us to improve access and quality of care in Austria. So first, you need to identify partners. You need to identify those healthcare professionals within your country that are looking after patients who have a clear focus on this disease and the expertise. You need to identify those in both the pediatric setting and the adult setting. You want to find out who is currently conducting NF-related research and establish contact, build a network, and explain your vision. So what is the vision of your patient organization? How can you maybe collaborate in the future? And it's important to make them realize that you have common goals and that you can create a win-win situation. Sometimes healthcare professionals view the patient as the problem, but the patients are not the problem. The disease is the problem, and the patients are actually or can be part of the solution. And this is very important to make healthcare professionals understand. Most medical universities, as well as the one in Vienna, really have on their website that they stand for research, education, and care. And as a patient advocate, I can 100% relate to these goals. So this is exactly what we want to do as well. So by working together, we can reach those goals much faster and better, and it's a win-win situation. So we started with very, very small projects where we could show the value of working with us as a patient organization, starting with developing patient information material together online and offline. We also invited healthcare professionals to join a medical advisory board so that they could give their inputs. We organized the first really small face-to-face meetings for patients and caregivers. We started to fund doctors and psychologists to go to international NF meetings, because back then the universities wouldn't give them travel budget to visit those conferences. And of course, I can understand that they're really interested in NF, but maybe not so much that they pay out of their own pocket to go to the US. So we provided travel grants, and they came back so inspired with new contacts, a new network, and that really translated to their work that they do in Austria. We funded the first joint research projects. The first research project that we funded was actually a psychological research project where we focused on neuropsychological testing. And this led to a grant that was achieved later on, which was the biggest grant that the psychology department ever got. So that really showed them, wow, through this research work, we got so much money afterwards. So yeah, that's how you can show your value. And also because we provide counseling and support to NF patients and families, that also takes some weight off the shoulders of the treating physicians, because they know, yeah, they are doing a good job and we can refer patients to them for additional support. So showing the value for collaboration was one of the first important steps. Then I think really important was, as I showed on my first slide, there were no educational opportunities for NF doctors or other healthcare professionals. So we wanted to provide those opportunities in Austria. So we launched the Austrian Scientific NF Symposium in 2017. And since then, we are doing this every 2 years. So whenever there's no European conference, we do our Austrian meeting. And this is really for healthcare professionals a great opportunity to know from the leading experts from Austria, but also we invite outstanding NF specialists from all over the world to give talks. And also, like you heard earlier today, doctors need to educate themselves every year. So they need to collect educational points, and we can give that to the doctors. We also start launching regional NF events with the local NF specialists in the different regions of Austria. And also we try always to get media coverage, media reports. So for doctors to be invited to give an interview to a news outlet, it's also a win-win situation, because they can build a career, a reputation as a specialist for a rare disease like NF. And so they have been on national television because of us. It's not bad either. This is a picture of the NF Symposium, where you can see Professor Wolkenstein from Paris giving a talk, and next to him is Jayshree Blakely from the US. The next big milestone, I think the biggest we had so far, was to create a dedicated center of expertise for neurofibromatosis patients in Vienna. To have a center that really focuses on diagnosis, on routine care and inpatient care was an incredible step forward, because before that, there was nobody really dedicated to NF. And waiting times in those departments that looked after patients were 6 months or longer. Now we had really the opportunity to shorten those waiting times drastically. We have a multidisciplinary approach. Professor Zizi explained to you how it looks like in Vienna. We also collaborate with other Austrian healthcare providers and build a national NF network of clinics. Yeah, and it's also important to build and share expertise. So also we did that by negotiating a collaboration, a written agreement with the Medical University of Vienna. So this is really like a contract that we have with them, explaining our responsibilities and their responsibilities. But also it was quite challenging to raise the necessary funds to get this started, because actually we pay for the necessary additional staff for this clinic. Here's a picture of the team at that time. You see psychologists, you see doctors and researchers on this picture, and a weird tall guy with a mustache. So our department is open for patients 2 days per week. And we look after about 250 to 300 pediatric patients from all over the country every year. We have those regular NF board meetings that are open to doctors from the whole country who can introduce their patients virtually to get expert advice from our center. And also our center is a member of the ERN Gentouris. This is how a typical visit looks like. So you see a father and his son talking to Professor Amadeo Azizi, and the woman to the right is not the mother, it's a psychologist. At every patient visit, there's a psychologist there, and every patient visit has 45 minutes. So really, that's how long you actually need to explain everything. And if you have a patient coming in for the first time, we reserve 2 slots. It's 1.5 hours. So you don't have that luxury anywhere else in our country. And if the psychologists see that the child might have some additional needs, we offer neuropsychological test assessments free of charge. And also we have a social worker. So another milestone was to also collaborate with other healthcare providers. So we developed, for example, the first NF1 specific rehabilitation program for pediatric NF1 patients that is covered by insurance. So they stay for 4 weeks, they get a personalized treatment plan, and they receive occupational therapy, physiotherapy, speech therapy, whatever they need. Also psychological therapy, because they can also come in not because of a medical issue, but also when they have psychological issues. We became a member of the Gentouris, as I said before, also joining or helping to set up the NFPU, NF Patients United, is super important for us. And I want to invite everybody who's listening, who is part of a patient organization, to please join us. And to become involved in the European NF group was a very important step, and setting up a network of clinics in Austria. And you can see we have really nice coverage. We are represented in 8 out of 9 Austrian regions, and work with NF specialists. Some of those we built through our scientific symposium. Have to speed up a little bit, I think. So collaborating with other healthcare providers, like helping to develop the clinical guidelines for tumor management, tumor surveillance in NF1 was something that we did. We also developed an Austrian care plan for both pediatric and adult NF1 patients. So they clearly assist doctors what type of assessments to do, in what intervals, and in what type of way. This has all been published, European guidelines, but also the Austrian guidelines. And we are always co-authors of these works as well. So coming back to my first slide, where you could see there was nothing there. And now we have a specialized NF department. We have an active patient organization. You can easily access information. We have regular awareness activities. We have regular educational programs for healthcare professionals, but also for patients and caregivers. We have an Austrian NF network. We have psychosocial support. We are involved in NF research that we also fund. And we are fighting every year to raise the sufficient funds to continue our work. So this is really not easy to do. But, you remember the picture of the desert, and I think now it looks more like this. It's like it's still surrounded by a not very friendly environment. So as soon as you take away the water, things can go back to the way they used to very quickly. So yeah, we also supported only through donations and grants and sponsorships. So this is the fate of all patient organizations. But we're really happy and proud that we could improve the landscape and the environment for NF patients in Austria. Thank you very much for your attention.